Well, of course, we're very pleased the House recommendation is the one that will be accepted. We feel it gives very much more medical care to ladies who are pregnant and who want to really do planning services even prior to pregnancies. The federally qualified health clinics are now eligible to receive those dollars, whereas only the institutions and the clinics, the organizations that provide abortions are no longer eligible to receive those dollars. So we feel that really if you're talking about really doing planning prior to pregnancy or taking care during pregnancy, that a federally qualified health care clinic is much better qualified than a specialized clinic that performs abortions.
Well, I think that's unfortunate because if someone really wants to reduce the number of abortions, family planning is the way to do it. And I think that what has happened is there's an attack on the use of contraception, and that this debate over abortion has gone into the use of contraception as a bad thing as well.
Well, of course, everybody has their own opinion. I disagree. I believe that the move of people being more responsible, understanding that they have to watch themselves more carefully, might lead to a better result, especially if now they can turn to federally qualified health care clinics all across the state. By the way, there's more of them, and they are better staffed and have more different options of planning available than do the specialized abortion clinics.
I would disagree on the more qualified because they all use nurse practitioners and physicians. FQHCs can do a good job of providing family planning services, but this is what I worry about. If it's shifted to FQHCs, the rules on FQHCs are set by the federal government, and so I believe this is being set up so that the law can be changed on FQHCs where they can't do family planning. FQHCs are what conservatives have used to take the place of providing health coverage for individuals. And for example, in 2003, CHIP was cut by $750 million. But the answer to that was to put $10 million in FQHCs. Well, that doesn't work. And so they have value. They can do primary care. I think that's appropriate. But I do believe that women need a place where that is for women.
Planned Parenthood and any other organization that performs abortion definitely were targeted. That's the purpose. We feel like that there should be many options available in planning a family, and that abortion shouldn't be the preemptive #1 option when you go to any clinic. It should be a full range of options. And of course, those of us that do not agree on abortions think that the qualified clinics across the state, which there are more of, better staffed, more professional medical opinions available that can serve more of the breadth of the needs of women, are now available rather than just one type that specialize and lead women more toward abortion than not.
Well, I think that what the result is that less women will be served. And what I mean by that is less women will have access to contraception, and because of that, we'll see an increase in the number of births, and particularly when we talk about limited income women, we'll see an increase in the number of births that are paid for by Medicaid and children that then go on the Medicaid program.
Well, of course, it's a war on birth control, on abortions, on everything. That's what family planning is supposed to be about. And it should give all of the options, not just one, preemptive above all. And that's what you see many times those clinics that perform abortions do. They emphasize that one source of their income, which is the major source of their income. We feel like the federally health qualified clinics now that are available statewide by more professional level of medical care give more options, better options, and higher quality of health care to all women.
Well, it's a betrayal of women. It's a betrayal of women. In this failed session, this is just another betrayal of a group of Texans.